This video is for general informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Please talk to your healthcare provider about your specific situation. You have been asked to provide a sputum sample to be tested for tuberculosis, also known as TB. Sputum or phlegm from your lungs will be tested to see if there are TB germs in your lungs. You have been given plastic containers to collect sputum. It is important to provide a good sample of sputum. In this step-by-step video, we will show you how to properly collect the samples. It is important to collect the sputum sample right after you wake up in the morning because thick sputum collects in the lungs overnight. It is best to collect your sputum before you brush your teeth or use any mouthwash or before you eat, drink, or smoke. Sputum is thick, slimy, or sometimes runny. The color may appear yellow, gray, or greenish, and if there is blood in the sputum, it might look brown or red. Saliva or spit which comes from your mouth is not sputum. Saliva is clear and watery. Discard any saliva or spit. In order to test for TB germs, we need sputum from your lungs, not saliva from your mouth. Since the TB germs can be released into the air when you cough, you should do your sputum collection away from other people. Collecting the sample outside or next to an open window is best. To cough up sputum from deep in your lungs, first relax, then breathe in and out deeply 3 times. Next, take a deep breath and cough hard to bring up sputum from deep down in your chest. Try to cough up at least 5 to 10 milliliters, which is about 1 or 2 teaspoons. You can repeat taking in 3 deep breaths and then coughing hard to bring up more sputum. Make sure your sample contains sputum and not saliva. After coughing the sputum into the plastic container, be careful that no sputum gets on the outside of the container. Place the lid on the container and close it tightly, making sure to avoid any spills or leaking. Confirm the outside of the container is clean and wipe down if needed. Place the container into the plastic bag and make sure that the container is upright. Return the sputum sample to the clinic the same day, if possible, or refrigerate the bag with the sputum container right away to keep it cold. Do not place the container in the fridge door or on its side. Keep it upright on the shelf inside of the fridge until you are ready to drop it off at the clinic. Do not put it in the freezer or leave it at room temperature. After you're done, be sure to wash your hands. Your sputum sample is going to be sent to a lab for testing. When your sputum test result is available, you will be asked to come back to the clinic. Your healthcare provider will share the results with you and discuss the next steps to make sure you get the proper care. Be sure to share any questions with your healthcare provider so they can address your concerns. If you want more information about TB, visit the Centers for Disease Control and Prevention website, cdc.gov/TB.